It can be a combination of things that lead to a acne breakout. So have you tried any at-home medications, or have you tried any remedies? Okay. Sometimes just drinking more fluids does take you far, is what I'll say. Do you have a history of eczema, psoriasis, or any sort of skin infection? Okay. Have you experienced hair loss, or have you noticed that your nails have changed in color or sensitivity? Maybe you see some lines or some dents. Okay. Do you have any allergies to latex? Perfect. Because I'll be doing a face exam that would include direct contact with my hands using latex gloves. Do you use sunscreen when you're going out? Even in the winter, you need to be using sunscreen. Okay. Any moles that you have that recently brought up on your skin? Okay. It's not always a red flag, but we just like to ask and take a look. So, when I do your face exam, I'm just going to pay attention to any sort of birthmark or okay. Are you feeling okay? I like to get the very small ones because I can actually do my job. So I'm just going to look around here. Can you tilt your head for me? Downwards. Okay. And lift your chin up. And move to the side. Any side. You can look here. And look here. Okay. Now, do you mind if I just gently give some pressure on your cheeks? I just want to make sure there's nothing crazy here. Okay. Do you feel any sort of pressure here? Okay, good. Now I want you to just relax your jaw. You don't need to have it tight. Just keep it steady for me. Okay, thank you. Just going to rub here. Now I want you to just close your eyes for me. I'm assessing some dryness right here, so I just want to look. Beautiful. It's nothing serious. It just looks like you should use some hydrocortisone and some oils that you can get over the counter, and then I'll take care of that. Can I just gently feel around here? I won't touch very aggressively, okay? I'll be very gentle. Just use one finger. How does that feel? Okay. Just gonna drag it. Okay. Let's feel right here. How does that feel? Okay. Okay, now I'm just going to pat around your scalp area, and I'm just going to scratch just a little bit and see if there's dryness over here too. Okay. Does that hurt? Okay. Yeah, there's a little bit of dryness. That could honestly be hair product though. You put some gel. Okay. Yeah, I don't see anything relative to your skin, so let's just press here. How does that feel? Okay. How does this feel? Okay. Now I'm going to just touch across your nose for any bumps or texture differences. Okay. Just tilt your head up for me. Let's just look under here and tilt it back down. Okay, good. Do you mind if I use a light? It's not that bright. I'm gonna just take a look here. You can close your eyes and look down for me. And just remember to relax your face. Okay. I'm gonna ask you to do some facial expressions for me. I'm gonna see if I can find dryness around your lips, so just frown. Okay, now relax that again and smile with your teeth not showing if you want. And now I want you to blow fish face me. Okay, good. I'm just gonna pinch here. Okay. Just relax your face. Okay. Alright, turn your head to the side. And other side. Alright. Now I want you to raise your brows, okay? Raise your brows. Raise your brows. Okay, now I'm gonna pull your chin a little bit low. Okay, yeah, you do have a little bit of oiliness on your forehead and right on your T-zone, but those are the pretty average spots that I see it. So, do you feel irritation around your eyes and your ears? Okay, because I noticed a little bit of dryness on your ears. Just turn a little bit. Yeah, it's a little bit right here. And a little bit right over here as well. That's okay though. We can just get some hydrocortisone right there too. Just make sure that you're not actually putting it inside of your ears. I want you to take a look at this face exam. I want to give you a bit of insight on the areas that I'm hoping to address today. So you do have oiliness right here and right here as well. These are the common spots for oiliness, unfortunately. And you do have a combination of dry skin right in the middle of your eyebrows, and then you also have a lot of oily skin. And sometimes this happens when we are not washing our hair as often as we should, and unfortunately that does happen a lot in the winter as well. under your eyes right here, you do have a lot of dry skin here. That could be due to an eczema diagnosis that you have, and we do see the same thing here where there's a lot of discoloration as well. And if you had ears on this diagram, I would point to them, but unfortunately you do have a lot of dry skin in this area right here. And under your chin there is a lot of hormonal acne there, and that's due to a lot and that's, you know, caused by a lot of oiliness, and that does happen sometimes. And I did see some acne like right next to the nose area as well, right here and right here, so I'll just circle that right here, circle that for you right here, so those two areas. And we did have dryness here, so circle that there. And then the pretty typically we see oiliness in this area and oiliness in that area, and circle this area too where we do see oiliness, but interestingly enough we do see a combination of dryness in this area. So you do have a lot of combination. So what we will do for that is probably give you a prescription of tretinoin, and this retinol is going to address that. So make sure that you are using that every single night, but in the beginning you want to wean into it, so you don't want to wear it every single night. You probably want to wear it like maybe twice a week, 2 to 3 times a night, only at night because it's very strong. So that should help you. And also just make sure that you're doing a face wash. You know, on the internet you see a lot of different products being advertised to you, but less is really more, so just stick to what works best for you. Okay, I wouldn't worry too much about hyperpigmentation or uneven skin tones, because usually that goes away on its own. And if you were really not happy with it, you can always just get a vitamin C, and that's something you can get over the counter. And that's really it. Do you have any questions? Before we do skin extractions, I want to gently dab your face with a towel so that you don't have to feel any type of pain whatsoever, because when you're doing skin extractions you want your skin to be nice and open so that the fluid can just come out without any struggle. I want your skin to be as less irritated as possible. So make sure you're always coming to a professional about this, because this can be painful if done wrong. But I'll be very gentle. Okay? Do you have any questions so far? Are you feeling okay? Okay, perfect. I'm just gonna get you right here. Okay. just a little bit more this side, and then we'll get started. Okay. Does this feel warm? Good. I made sure to keep us in hot water. You gotta boil it right before your appointments, you know. Okay, let's just close those eyes for me. Close, close, close. Close your eyes. Let's get above your T-zone here. Okay. There you go. Alright, let's begin. So we got our shipments today. These tools, they look more scary than they actually are. So this is what we're gonna do. Gonna gently just trace around the pimple just to see what I'm working with. And looks like this little whitehead is ready to come out. Just gonna poke this very carefully. Okay, that hurt? No. Okay, let's just get this one out. Okay. Just stay still. I'll just pop that. Feel okay? Okay, let's get one that's a little bit lower. Okay. Now tilt your head down for me. Just gonna spread this out. Okay. Okay. Let's get this one down here. Just tilt your head towards this side. Just gonna get you right here. Okay, perfect. I'm gonna clean that off. Toss that in the trash. Just get a little bit of pressure here. And a little bit of pressure here. I know that this area is usually a very sensitive spot, so I'm trying to be careful. Just grab here. How does that feel? Okay. Just grab here. Okay. Gonna get a little bit lower here. Just stay still. Just gonna pull your nose a little bit. Okay. Is it okay if I go around your eyebrows? Just gonna touch here. Just poke a little bit. Sometimes when you press the skin, you can irritate it a little bit and get the blood moving. That way the liquids will just come out a little bit easier. So I'm just gonna pop this, just like that. Okay, I'm just gonna pop that. That. And that. Okay. Okay, then I'm going to use the back here, and this is going to safely remove anything else that's coming up. Okay, good. It's a lot of good pressure here. Okay. Just wipe that off. Just gonna poke here again, very carefully. I won't be too harsh. Let's just poke here again too. Okay. Just clean that up. It's a little bit of liquid. Okay, there we go. Just clean that up more. How are you feeling? Good. That's good. Try not to sneeze. Okay, good. Get you right here. I know it's a little cold. You'll be fine. Just pinch that off. Pinch that off. Okay, let's get you right here. It's usually the worst spots, is like right around, yeah, the oiliness. I know, let me get you right here now. Let's push that down. Okay, let's just hold your hair back. Okay. Let's get you right here too. Okay. How are you feeling? Can I get your nose right here in the middle? Okay, let's just grab that and just wipe that down. Just scoop all that dirt up. All that dirt and oil. Okay. Let's get you one last time. Okay. Let's go for a couple on your forehead. Just pinch that down. little bit more. Let's just pinch a little. Let's pinch. Does that feel okay? Okay, good. Let's just press down a little bit. A little bit of pressure. A little bit right here. And right there. Okay. And one last wipe. Okay. It's not so bad, right? Keep saying that I'm almost done, but then I see another one. See right here. Just grab that. Okay. Just get you cleaned up all the way. Okay. Just gentle strokes. There you go. How you feel? You feel okay? Good. You're all cleaned up. Let's get your neck too. Can't forget your neck. You know, like, you can get breakouts under your chin too, so you have to be careful of that. Okay, so. Let's take a look here. Okay. Does that feel okay? You don't feel anything irritation wise? Okay. Let's just do a few tests. Do you feel that? Okay. Do you feel this? How about that? Feel this there? Do you feel that there? Okay. Feel this. And how about that? And do you feel this? How about that? Cool your face off. You had a lot of stimulus, so I'm gonna just let your sinuses depuff with this and this cooling agent on the Rolling Stone is going to shrink your pores and lock in all of that product to brighten up your skin, protect your barrier. I get a lot of morning puffiness on my face. I like to just drain it out with using a gua sha or a jade roller. You can use either side, but I prefer the bigger side. Just relax your face. You feel any swollenness here? Okay, how about here? You feel anything there? Any tenderness here? Anything itchy, burning, bruising? Okay. Okay, I just want you to look straight at me. Just focus on my nose. You don't have to look at the light. I'm just wanting to take a look here. You just scooch a little closer. Do you have any irritation on your left side or your right? No, I don't see anything. Just gonna pinch around here. Okay. Just some normal redness. Alright, just look right here. Perfect. Okay, your skin looks beautiful. Nice, supple, even looks hydrated, so I'm glad that our session was beneficial to you. And just look down for me. I'm gonna look at your forehead. Okay, so for your prescription, are you still at the same pickup pharmacy? Okay. And should give you the directions on the amount of applications that you need and in terms of the daily dosage and how many times a week that it's recommended to use the tretinoin. Just gonna write that down for you though, just in case you forget. So here, just take that. Thank you for stopping by and take care.